At the Slocum Center for Orthopedics and Sports Medicine, we are proud of our heritage of orthopedic educational excellence, surgical expertise, and exceptional patient care. It is for this reason we dedicate this video to our inspirational founder, Dr. Donald B. Slocum. Don Slokum was a world-renowned orthopedic surgeon and a true pioneer in sports medicine. His values and dedication to the profession and to patients continue in the practice that thrives today in his honor, and in the stories and memories of his early partners, Dr. Dennis Collis and Dr. Stanley James.
Well, my first impression of him is he certainly was a respected person. I was not even an orthopedic resident at the time. I was just in the military as a general surgeon, and he basically was asked to be the speaker and commentator, and he had a lot of knowledge, and obviously he was so far ahead of me that I really couldn't form an opinion, except that he was respected by all of his colleagues.
Well, he was a very amicable guy. I guess the first impression I had, though, was when I was here, and I've been here for a very short period of time. And at the University of Iowa, in our program, we were encouraged to ask questions. You know, why are we doing it this way, and so forth. And I remember one day, Dr. Slocum showed me a case he was going to do and told me he was going to do. And I said, well, why are you going to do that? He looked at me and said, just because that's what we do. I went, oops, won't do that again. And then about a day later, he came back and said, the reason we're going to do what I suggested is this. And from that point on, we had these great discussions in the office, frequently falling way behind schedule with our patients because we had so much fun talking about the cases that we were seeing. Became a great mentor for me. I think my favorite memory of Dr. Slocum was his approach to surgery. And frequently, he very rarely saw a normal knee. It was usually a knee that had 2 or 3 surgeries. And I remember one day I asked him, well, what are you going to do when you get in there? And he said, we'll just do what we have to do. And that was his approach to it. And at that time, we had several visitors come by to watch him. And we'd come out of surgery, and they'd often ask, what did he do? What they were looking for was a recipe. You know, step 1, step 2, step 3. Well, that isn't the way Dr. Slocum functioned. He functioned off a knowledge of the principles of function of the knee. And that made him very adaptable in approaching a lot of unusual problems. And that was something I learned from him. And I think that's the biggest gift he gave me, was to focus on the principles behind what you're doing.
I think probably when I first met him as a resident, he came as our senior speaker or authority on orthopedics, and having dinner with him and noting his broad knowledge about everything in orthopedics.
Well, I was still in orthopedic training, and I'd heard about Dr. Slocum and his interest in sports medicine, and he was truly one of the fathers of sports medicine in this country. So my second year in residency, I thought I'd come out to the Northwest and look around, see what's available. And one of my visits, of course, was here in Eugene with Dr. Slocum. And when I left, I decided that's where I would really like to go, and I had my fingers crossed. And about 2 weeks later, I had a contract sent to me. So I was signed, sealed, and delivered before I even finished my orthopedic residency.
Well, Don's development of the practice had been his idea, and he was really the head of the office. Now, by the time I came, Don was not quite doing as much surgery as he had earlier, but he got in the office to agree to an office contract here for the employment of the orthopedist that involved a very unique dedication of time. That is, you had 6 weeks off for the year, period. You had weekends, but 6 weeks were off. 4 weeks was to be dedicated to educating yourself with some form of orthopedic knowledge. Either you go visit somebody, you write a paper, you do a study, That was 4 of the 6 weeks. The other 2 weeks you could vacation, but you couldn't vacation 6 weeks. There was no aspect of dedication for 6 weeks of vacation. It was 4 weeks education, 2 weeks vacation.
I think Don Slokum could be described as very inventive and very inquisitive. Don would look at a problem in orthopedics that had an accepted way of managing it and say, well, you know, that's the way we've looked at it for years. Let's turn it upside down and see how it works. So he was always looking for something better. And that was reflected in his surgery. He would modify his surgery as necessary. And like I said, he functioned off the principles and the knowledge of basic science about the knee, the ligaments, and how they work. And it was that inquisitiveness and that drive to improve his results that I think defined him the most. You know, before he got into sports medicine, he had the premier atlas of amputations that was available. During World War II at Walter Reed Hospital, he did extensive studies on how people walked and how prosthetics would work, and he published an atlas of amputations. And he was well known in that area before he got an interest in sports medicine. So he was an established entity, orthopedically, before he got interested in sports medicine.
I think Don Slokum would be very proud as he reacted to this building and saw it today with his name on the top. He was a very proud man, very proud, and he wasn't arrogant, he was just proud. And I think he would be proud that his legacy was that a building that encompassed the things that he had goals for, that is good patient care, outcome collection of data, a practice setting where the physicians could practice their very best. He'd be proud of that. And he'd probably look at himself and say, I guess I deserved it.
I think Dr. Slokum's attitude toward the Slocum Center for Sports Medicine and Orthopedics would be very favorable. He, back in the 70s, or in the late 60s when I first arrived, that subspecialization was probably the way to go. Up until that time, general orthopedics was probably king. Everybody dabbled a little bit of everything. But Dr. Slocum felt that we should subspecialize, and he initiated that. I think he'd be very proud of what's happened over the years, and that we have this building named after him and the group of orthopedists that work here. He deserved every bit of the accolades that he's gotten through the years, and I think having a facility like this named after him is perfectly appropriate, and I think he would have been very pleased with it.
The values that Don Slokum promoted or promulgated with his insight into the practice of orthopedics was that there are problems with bodies that you can fix, and you need to apply your best abilities to develop your own practice in your own way to best treat those patients. And you needed to be caring for the patient in a way that exemplified excellence in all aspects of it, not just in what you can do with your hands in terms of doing the job, but in what you can do with your thought processes about deciding what to do. And that was really one of Don's greatest strengths, and I think he inculcated it in everybody around him, that you got to look at the problem, see what it is, individualize the treatment of that particular patient's problem. And I think that would be his main legacy, but he also was efficient in his work and a very caring person.
The important thing that people need to know about Don Slokum is that he was actually a world-famous orthopedic surgeon. It wasn't just a local phenomena with Don Slocum. And I don't think people here realize the extent of his reputation and the respect that he had around the world.
Well, my perspective of my personal practice, which was predominantly as a hip surgeon, I had the great opportunity to come to a community where I had the support of a really good hospital, an office that let me develop that practice, a senior member of the group, Don Slokum, who probably lobbied on my behalf at the local scene and maybe even the national scene. He would never tell me that, but I had the opportunity to develop a practice which took care of patients with joint replacements when the procedure, when I started, was pretty new. I mean, it was just being done for a year or so in this country. And I got to watch that evolution through 40 years of change. I got to meet the kingpins, if you will, in orthopedics. I got to be on panels with them, talk to them, evaluate problems with them, develop some research with them. The main thing I got to do is on a daily basis, I got to take care of those patients with their orthopedic problem, and I got to change their lives. I don't mean that I was so great, but I had a great operation that worked well. And on a daily basis, I saw patients come back to me and say, "Boy, thanks a lot." And it changed their life, each individual, but it changed mine.
Although Dr. Slocum passed away in 1983, his memory continues to live on every single day in the doctors and staff at the Slocum Center for Orthopedics and Sports Medicine.